And now, get ready, folks. It's time for Banter with Bob Sherwood and Dan Snell. Banter. And now, here's Bob and Dan.
Hey guys and gals, good morning, good morning. It's Friday. I'm in California on my way to Hawaii. Now, what's more important today than health? And we've been watching the Kennedy hearings, and Dan Snell has got a health expert on for us today that we're going to talk to and banter with. So Dan, go ahead and introduce our friend Keith.
Okay. All right, Bob. Thanks. Yeah. This I know, my banter partner, Bob, you are an energetic, healthy, young man. There you are. You're going to go to Hawaii and walk on the beaches and take in the sun with your family. And so you work hard at staying healthy and physical fit. And so, as you said, hey, make America healthy again. That's what we kept hearing. Donald Trump got elected on part of that as his concept. He wants Robert F. Kennedy Jr. to lead the way. On a personal note, this morning, health. I just left my personal doctor.
What about what you're supposed to introduce? Are you going to do that eventually? Or
what's that?
You're going to introduce somebody that we're interviewing, right?
See, Keith, welcome. When
are you going to do
this
it?
Is classic Sherwood banter. I'm getting there, Bob. We're in the process. My doctor says I'm healthy and fit. But how do we stay that way? And bigger than that, lifelong health tips. And so we've got Dr. Keith Jantz joining us, 45 years in the medical profession, semi-retired. He speaks around the country and writes. And so recently I talked to him. He said, hey, remember the old days of David Letterman? Who didn't love the old David Letterman top 10 list? Top 10 list. So we've got the top 10 list, how to stay healthy and young. And so anything on all that introduction, Keith, that I missed or you might want to add?
Yeah, that's pretty much it. I practiced internal medicine for over 40 years, and so I stay active, paying attention to the latest health.
Keith, are
Yeah.
you healthy?
Yes, I am.
And how do you know that? What indications are about yourself that you conclude you're healthy?
Welcome to Banter, Keith.
No, it's just a standard question.
Okay, first of all, I know my blood sugar is normal. I know my blood pressure is normal. I check it every day. And my LDL is down low. I take blood pressure medication. Also, I can go out and run 2 miles without stopping any day of the week. If you want to take me on and assess my health status on the basis of that, feel free to do so.
What's your body, your body index?
My BMI?
Yeah, BMI.
BMI is 26.
What's your blood pressure?
140/80.
Do we not have to have HIPAA? Do we not have to have HIPAA laws here, Bob Sherwood?
No, Dan. You need to understand that HIPAA laws don't apply when I'm willing to disseminate my own personal information about myself.
Good
On the
point.
other hand, if I want to know Bob or your information, I am not privy to that unless you're willing to share that with me. And don't ask me about HIPAA because I've lived with HIPAA for 15 years and it's a pain in the neck.
Yes.
And is it getting, let me jump in that just for a second. Is HIPAA putting more restrictions on doctors today than it did 10 years ago?
I don't think so because everyone's pretty much adjusted to that. And so it just changed our routine about 10 or 15 years ago, but everyone's adjusted to that. I think the only problem for that is that, if you're in the hospital and one of your relatives or a friend wants to find out what your status is, they cannot unless you give them the okay. And most of the hospitals have done this. They've had inpatients give a secret word, something like a password. And if you give that password to your friends or relatives and they call up and say, hey, Bob's in the hospital. How's he doing? He's in the ICU. Is he pretty sick? What's going on? And they say, well, I'm not supposed to tell you anything. And so, well, Bob gave me this password and you give the password to the nurse, and then then the nurse is free to give you medical information about the person you're asking about. So hospitals have figured out a way to get around that.
Now, on this health issue, by the way, I'm very impressed with the 2 mile running. That's pretty good, I think. I assume you do like 6 or 7 minute miles in that, or 8 minute miles.
Well, I used to do masters running, but yeah, I don't do 7 minute miles anymore.
So
10 is
that's
good enough for me. And actually, what I try to go by is James O'Keefe, who's a famous cardiologist at St. Luke's Hospital here in Kansas City, has done a lot of studying of marathon runners and coronary artery disease, and he has determined that the sweet spot is to probably run about 25 miles a week. And actually, marathon runners, if you run more than that, your cardiovascular benefit is not necessarily generated by excessive running. So,
so now you look like a healthy person just looking at you on the screen. My question is, have you always been healthy? Have you ever been unhealthy?
I don't know what your definition of unhealthy. I mean, I've had health
Well,
issues.
you gave me a definition of healthy, so reverse all that,
Okay.
right? Have you always been able to run 2 miles, for example?
I've never been overweight. To answer that for, I've never had diabetes or anything like that. I did have atrial fibrillation about 15 years ago and addressed that and determined the cause of that. And so I keep a close eye on my heart. And part of my talk has to do with individuals determining what their major health risk is. And one of the most important ways to do that is to take a look at your ancestors. We are becoming more and more aware of the fact that genetics play a role in inherited tendencies toward diseases like cardiovascular disease, cancer, and things like that. So I took a look at my father, who had coronary artery disease and had bypass surgery, and I knew that I was at increased risk for that. So I've paid more attention to maintaining my cardiovascular health as opposed to cancer per se. So cancer doesn't really run in my family, but heart disease does.
Sure.
So I want to pay more attention to cardiovascular disease personally if I'm going to maintain my own personal health and increase my longevity.
That's exactly where my question was going, was how much of your healthness was attributed to, let's say, your DNA, and how much of it was attributed to you yourself. In other words, it sounds like you had healthy parents, except for your
Right.
I guess the cardiovascular issue, right?
Right. Mm-hmm.
So they take a lot of data. The other day I met my doctor, and they met my family history and all that kind of crap. But now there's a company that's actually going to take all that data. Most of that data is not used by the doctor, as a matter of fact, because they don't change their medicine. If you say, oh yeah, my dad docked at 38, oh well, their case I had to give you a different prescription. So it's not evidence-based. It goes into unstructured data. So there's a company called Tempest now, which has got a huge amount of money to take all this unstructured data, like family history, and do some predictive analytics on it. Now, are you familiar with anything like that?
No, I'm not, but I think it's moving in the right direction. I've tried to tell people how to do that with their own personal situations at home, because, getting to the public with trying to improve the health of the public is something that it's something we can talk about companies like that, but if they offer a service like that and the service is expensive or it's not attainable by everyone, then I don't address that. What I try to talk to is people about, and that's part of the top 10 thing, is these are simple things that you can do at home. These are simple things that you can do to change your own personal lifestyle on a daily basis that will increase your chances of living longer. And so that's where the top 10 comes in. I've tried to keep it simple because we're usually speaking to the lay public. We're not speaking to the medical public that are medically oriented, and we're not speaking to people who have access to a lot of tools like the Tempest that you're mentioning. And some of that's new, some of it's coming along and needs to be perfected to some extent. But I've tried to keep it simple, and so that's what my top 10 focuses in on. These are things that people can do at home every day that they're not doing right now, and this is why people die earlier than they should. So that's the point of my discussion, my talk.
Yeah, I love this. As you were talking about that and thinking about the top 10 list, and of course, we all enjoy our Kansas City Chief fans here. and going to be in the Super Bowl. So let's imagine if you could be standing at the 50-yard line right there on the NFL Super Bowl emblem on the Super Bowl Sunday, and you were speaking to, well, there'll probably be what, 85,000 fans there and the entire nation, biggest TV audience, and you got to give your top 10 list. We may not be able to get all, we might have to do two programs, two podcasts on this, but it's funny because if you imagine the people there have probably stayed up late for a few days, they've probably consumed mass quantities of alcohol or eating hot dogs and other unhealthy stuff, and it's time, and the announcer comes, ladies and gentlemen, on behalf of the NFL, we now introduce Dr. Keith Jantz with a top 10 list how to stay healthy. So, Keith, working downward, let's start with number 10.
Well, number 10, the first thing I would say is 45% of you 85,000 people in this stadium are going to exit this earth because of cardiovascular disease, either heart attack, stroke, or heart failure. And so you need to pay attention to the risk factors that will reduce your chances of experiencing heart disease. So when you go see the doctor and you get your routine physical, there are three things you want to look at. You want to look at your blood sugar and make sure that you don't have diabetes. You want to look at your blood pressure and make sure it's controlled. And you want to look at your cholesterol and make sure that your bad cholesterol or LDL cholesterol is down within a reasonable range. These are the three factors that will impact a person's longevity from a cardiovascular standpoint more than anything else. So that's the one thing I would tell them. And then I would tell them also that 25% of you are going to die of some type of cancer. So pay attention to the three most common cancers that you're likely to experience in your lifetime. Well, for women, that's breast cancer, lung cancer, and colon cancer. And for men, that's prostate cancer, colon cancer, and lung cancer again. And then we would talk about ways that we could screen for that, because there are ways you can screen for these diseases. And also genetics becomes extremely important, because if you're a female and there's a history of breast cancer in your family, particularly a first order relative, your chances of getting breast cancer in your lifetime are 1 in 6. You think about that, 1 in 6, and if you don't screen for that, you're doing Russian roulette. It's the same thing as putting a chamber in the gun and spinning it and putting it to your head and pulling a trigger. So don't do that. Well, how do you not do that? Well, you get screened. You get mammograms every year, which is what we recommend for women who have that kind of a family history. Mm-hmm. So same thing for colon cancer, which is unfortunately increasing in frequency in our country. And we used to tell people to get colonoscopies at age 50. Well, now we're moving it down to 45. And why are we doing that? Well, because younger and younger people are coming down with colon cancer. And why is that happening? Because the diet in the United States is a horrible diet and increases your risk for colon cancer. But what's more important is, if someone in your family, if you have a blood relative that had colon cancer, then you need to be more and more aggressive about screening yourself for colon cancer. You need to get that colonoscopy earlier, and you need to pay attention to the findings of colonoscopy, figure out what to do from there, depending on what the colonoscopy shows. So the good news about that is if it's completely normal, you're good for at least 10 years and maybe good for life. We're in the medical community, we're still trying to determine what to do in terms of follow-up for someone who has a totally normal colonoscopy. So genetics really play a role in this, and it's really important with lung cancer too. You know, if I would tell these people, hey, if your father smoked, and a lot of those people in the stands, I'm sure, would say, mm-hmm. Someone in my family smoked. If your father smoked and died from lung cancer, and you smoke, you're asking for trouble. You're just
Keith. Let me interrupt you for a second.
Sure.
Because that's what I'm known for, by the way.
Interrupting.
How did we miss smoking? I mean, in the 50s and 60s, everybody was on TV, the Frank Sinatras, the Dean Martins, all are in movies, all pushing smoking, all doing advertising. How did we miss that for 50 or 60 years?
Well, there are two reasons. One was denial, because in 64, mm-hmm. the Surgeon General came out and said that smoking will cause increased cardiovascular disease and cancer. Mm-hmm. And so the tobacco industry pushed some of this down and de-emphasized this for years. And they continued to come up with ways. First of all, they hid the data. They had the data that showed that it was a health risk, mm-hmm. and they hid that because they knew it was going to be, it was going to impact their mm-hmm. sales. And then when it became more and more clear they started recommending alternative products like vaping and other tobacco products like that. And unfortunately, now the data shows that no matter how you ingest tobacco, whether it's chewing or vaping or smoking or cigars or pipes, it's still going to increase your risk.
Don't other countries smoke profusely and live as long as we do?
I don't know if they, well, I don't know about the incidence of lung cancer, but yes, certainly.
I mean, there may be other
In
things that
Europe, I
cause.
think you're right. In Europe, it's amazing. Europe is the only place I ever saw where I saw somebody riding a bicycle and smoking at the same time.
Right. Well, my brother-in-law used to smoke while he pulled his oxygen tank around the house. So, I mean, people don't follow directions. But now going back to the question of age, you said earlier that we're living shorter than we used to. How do we compare
Right.
with other countries? And what does that have
Well,
to do with health?
we're 17th when you compare us to other
Yeah.
Western civilizations, countries that are considered Western civilizations in the earth. Our life expectancy is 17th, and you would think, and our health expenditures are pretty near the top.
Sure.
So we're not getting a good ROI. We're not getting a return on our investment.
What's the number one country that lives the longest?
Oh, wow. I'm not sure on that. It might be one of the Scandinavian countries like Sweden or Norway, someplace
Yeah,
like
I
right.
think it's Norway.
Yeah.
I think somewhere recently I saw something like that, but it used to be Italy
Yeah.
because of the wine, they said, but now I think it is in the Scandinavians. You're right, Keith.
Well, then Italy may not report when they die. Yeah.
Well, I can give you a whole spin on the wine issue, which
Yeah.
is a completely separate issue. I think that's probably number 8 or something on my
Yeah. Well,
list.
go ahead. Go on with your other health list, and tie in your opinion, if you would, about what Kennedy is supposedly doing. I don't quite understand everything he wants to do, but do you have an opinion on that?
Well, the interesting thing about Robert Kennedy is the first time that he came out, he was a strong anti-vaxxer. And of course, those of us in the medical profession thought that was ridiculous because we've known for years that vaccines are effective ways of preventing a lot of infectious diseases. So Kennedy was kind of coming from the bottom at that point. But there are a couple of things that he has pointed out that I think are really of interest and that our country should pay attention to. One has to do with that he wants to take on big pharma. It's pretty clear that the pharmaceutical industry has kind of focused more on improving their bottom line with their profits so that they can pay their shareholders, as opposed to providing medications to the public at a reasonable cost that's affordable. And there's been a lot of problems with this in the pharmaceutical industry with regards to insulin. Diabetics need insulin, and they've tried to control the cost of that. Another one was EpiPens. EpiPens are a great way that people who have allergies can abort an allergic reaction immediately at home without having to go to the emergency room. When the EpiPen company was sold to another company, the purchasing company jacked the price up to an astronomical amount. So Robert Kennedy Jr. wants to take on the pharmaceutical companies. That's one thing that he intends to do, which I think may have some benefit for the country. The other is he wants to take on the food industry, which I think is really interesting to see if he has any effect on that. 70% of all the food that's sold in the United States today is ultra processed. And there is a lot of data out that indicates that ultra processed foods are associated with an increased incidence of heart disease, stroke, hypertension, obesity, diabetes, depression, and this is the killer, cognitive decline. So believe it or not, if you eat too many hot dogs, your mental function, your cognitive function is going to decline. And so, we've got a country that's full of people who are developing Alzheimer's and dementia due to other causes, not necessarily Alzheimer's. And the question is, how much are the ultra processed foods contributing to this?
Yeah. Oh, that's
Well,
a
let me
great
throw in a fact. When I lived in Paris for 3 years, I ate everything I wanted to every day. I didn't hold back on anything. I ate a lot of food. I could never get my weight over 180. And usually it was 178. I could go stuff myself for 2 days. I'd come back and weigh 178. I moved back to the United States. I can't get my weight under 205.
Well, if you're
unless
eating,
I absolutely starve myself.
yeah, if you're eating ultra processed foods, there are chemicals in these foods that don't need to be there and are not healthy for us. And if I go down the list of ultra processed foods, you're not going to like this because the top of the list is ice cream.
Mm-hmm.
In addition to that are hot dogs, potato chips, um, sugary beverages, sugary cereals. I mean, our kids eat sugar cereals every morning.
Would you
And
be in favor of just eliminating hot dogs, just taking them off the market?
yeah, that'd be nice. Or find them an alternative. Create hot dogs that you don't have to put all of these chemicals in
Uh,
them.
but
Yeah.
So,
until we do that, until we could do that, since it's unhealthy, as you say, and it's very clear what you're saying, why not just pass a law? You can't sell hot dogs anymore as they're currently set up. Just take them off the market, 100%.
well, in theory, that sounds great. Why don't pass a law and eliminate tobacco and alcohol
It's a
too?
good idea too,
Of course,
and that's why we don't
Oscar
do that.
Mayer's going to
it,
come after the show, Bob. They're going to come after Banter, and Oscar Mayer's going to protest us. And
Oh, I
well,
don't think so. I
well,
don't
I
think.
think the problem is that these food industries are going to come after Robert Kennedy Jr.
yeah,
when he tries to put these changes into effect. They're either going to come after him or after Trump. And I don't know if Robert Kennedy Jr. will survive that kind of an onslaught that might come from the heavy lobbyists that are going to come from the food industry. And they're either going to go at Congress or they're going to go directly at the White House. And you know how that filters down from the president down to people like Robert Kennedy Jr. So I'm all for what Robert Kennedy wants to do. I'm leery about whether he's going to be able to affect major change in some of our food problems that we've got in our country.
Well,
But
here's
that,
what I don't understand. You're a doctor, 45 years. You're obviously extremely articulate, passionate about what you believe, and have evidence. Why aren't more people getting on your side and saying, let's just get rid of hot dogs? Let's get rid of potato chips. Why aren't people more concerned about exactly what you're talking about?
well, there are two big reasons for that. One is advertising. The public is absolutely inundated with advertising for terrible foods. If you watch ESPN or CNN or anything like that, you're going to see ads for foods that are not healthy, but
Yeah.
these companies want to sell them because they're profitable. That's the number one reason. The other reason is cost. Uh, Healthy foods are more expensive, and people who are living on a limited income, poor people or people who are impoverished, something like that, they tend to buy unhealthy foods, and that contributes to diabetes and obesity in these people, and it increases their health problems. So we see a lot of that in the South. We see a lot of that in marginalized people of color, anyone. And it's going to get worse as some people lose their jobs. They're talking about cutting out some federal employees. Well, you need to feed your kids. And
I was at a doctor's office a couple of weeks ago, and I was counting how many people that came in my opinion, were obese. And my definition was if their stomach was hanging over their belt. And I would say it was 1 out of 3 people. And I don't mean 20 pounds overweight. I mean like 40 pounds to the point where I'm looking at them, I'm thinking they got to be uncomfortable. They can't wear their clothes.
I'm tell you about, I'm more critical than you, and I've done that on several times in the public, and my numbers are easily over 50%.
Really?
Yeah.
I sometimes I want to run up and shake them, and I'm saying, and then on top of that, maybe they have a 12-year-old child with them, and guess what? That child is already looking obese.
yeah.
He looks at his parents. Go ahead.
I was just going to say, do you think we talked about earlier with cigarettes, 1964, the data was there, but it really took like into the late 70s or 80s for it finally
there are many
come
people
about
here
that we got to put warnings on the label. I mean, I enjoy when I'm selling peanut butter, right? And I look at what's in this peanut butter and some of the words I can't even pronounce. Do you think the next big breakthrough of, wow, look at this, looking back, is going to be processed foods, how bad it was just as cigarettes? You think of that processed foods? And then the second part of that question, I understand in Europe, they make General Foods or General Mills, whoever makes their foods, they have to deliver the same product, but they can't have some of the chemicals and stuff in it. In Europe, I think it is that. I
Well,
think that's
to answer your question, Dan, it's already started, and it started a few years ago when a lot of parents started forcing grade schools to take soft drinks out of their vending machines in grade schools and started putting apple juice and orange juice and things like that in there that were safer and better for kids because they didn't have as much sugar. And the other chemical that you may see in your peanut butter is high fructose corn syrup, which is just absolutely an awful substance. And there are some countries in Europe that have it banned. So, Bob, to get to your question, how can we solve this? One of my approaches is uh, it's simple, it's just not easy. And I try to make it simple. And here, let me tell you two simple things that I think people can do if they're personally concerned about this issue of ultra processed foods. First of all, when you go in the grocery store, buy the food that's around the periphery of the grocery store. The healthy food in the grocery store is being sold around the outside of the grocery store, and the food that's being sold in the center of the grocery store is unhealthy, ultra-processed food. It's just a simple rule of thumb.
Now, what's your diet? What do you eat during the day?
Well, for breakfast, I will eat shredded wheat with bran. I
All
like the
right.
bran because it reduces. And the interesting thing, if you take a look at the ingredients listed on shredded wheat, none of those chemicals are in there that are in all these other cereals like Fruit Loops and Cocoa
Mhm.
Puffs and stuff like that. So I
Those
like
things are
that.
terrible. Yeah.
wait, Cocoa Krispies? I can't have any more Cocoa Krispies.
So
Ah,
shredded
I'm
wheat.
sorry, Dan. You know,
It,
Dan, Dan, if you really start talking to me, you're going to be sorry you get to know me because I'm going to ruin your life.
now, what about what do you eat with your bran? Milk, bread, toast, what?
Either skim milk or almond milk. There's kind of a lot of discussion about which is safer, almond milk or
Hmm.
skim milk. And I don't think the data really indicates one better than the other. But yeah, I got away from whole milk a long time ago and I went to 2%. Now I've gone to skim milk. I usually put some fresh fruit on it, some blueberries or a banana, something that's fresh.
All right.
The brightly colored fruits tend to be higher in chemicals that are beneficial from a health standpoint. So berries like strawberries, I'll get some if I can get them fresh or something like that. And the
Hmm.
interesting thing is some of these stores put this stuff on sale, and you just wait for when it's on sale and then buy it. It's not
Hmm.
that hard. That's part one of what I think people need to do. And part two that I think people need to do is to start walking. 30 minutes every day. Just walk for 30 minutes
Hmm.
nonstop every day. It's not difficult, and it's something that almost everybody can do. And if they would do that, they would lose about a half a pound a week. Even if you don't change your diet, even if you don't change any of your habits, but the only
Hmm.
thing that you decide to do differently is you start to walk for 30 minutes every day. You will lose a half a pound a week. Well, that doesn't sound like a whole lot, but 25 pounds in a year would work pretty good
Sure. Right.
to us. It'd be
Now,
really be nice.
my simple mind boils down to weight to a math problem. It's calories in versus calories out. Do you think it's that simple?
For most people, it is. There are a few people who have an endocrine problem that they
Hmm.
cannot lose weight,
Hmm.
but they are in the minority. The vast majority of us
Hmm.
are in the same boat that you're in. It's calories in, calories out.
Right.
And and so the interesting thing about the walking is there is a study that shows that people who have a sedentary lifestyle, who don't exercise at all, their risk for cardiovascular disease is about equivalent to those who smoke a pack of cigarettes a day.
Hmm.
And that's a real shocking thing when you think about it. Because we used to think smoking a pack of cigarettes a day was one of the worst things you could do for your heart. And now we find out that living a sedentary lifestyle where you don't exercise regularly every day is
Yeah.
just about as bad as smoking a pack of cigarettes. So this is something people can do, and it doesn't cost them anything.
Yeah, I
Uh,
agree with the whole concept of walking. Our family, as some of us are a lot healthier than others, but many of us have a target of 10,000 steps a day. Not me personally, but my wife and my daughter-in-law, that's their target. I probably can do on a, if I'm really, even like today, yesterday at the airport, I'll probably do 5,000 steps a day when I travel, which is, not a lot, not near 10,000, but it's more than I do when I'm home working, where I am reasonably sedentary. But yeah, everybody that I know about walking says the same thing. Just keep moving, keep walking. And I think that is simple, but here's my point. It's so simple Why isn't everybody do it? I don't understand that. What's the behavioral implications?
Yeah, that's a good question. And, it always amazed me. I would try to tell my patients this for years, and then they would come back every 3 or 6 months. And no, I'm not doing this. And no, I'm not doing that.
Yeah.
What is the behavioral aspect of it? I don't know. I don't know how you incentivize people.
Mm-hmm.
We in the healthcare industry, in the health insurance industry, we're always talking about the carrot versus the stick. And the stick doesn't seem to work. And so some employers realize that the carrots seem to work better. And so they would,
Yeah.
reduce someone's health insurance premium rate that was deducted out of their weekly salary by maybe $25 or $50 if they could prove that they went into a doctor and they got
right.
and that kind of stuff. And so that's still the battle. That's still the battle between the medical industry and the public.
See, for me, it's what I call a Pavlovian issue, is that the further away the benefit is from the activity, the harder it is for somebody to do it. Now, walking every day, okay, I can do that, but because I don't, when I get to my home, I don't see a reduction in weight. So it's not very Pavlovian, right? My insurance company doesn't write me a check because I do that. So what's the motivation for me to do it? It's almost like a spiritual. It's like I have to be spiritually motivated to do it because I'm not going to get paid to do it. The results are so minor from day to day, right? As you point out, gosh, over a year, 25 pounds, that's a lot from just walking that much, right? But most people, in my opinion, behaviorally speaking, are very Pavlovian. They do not take the long-term view. If they don't get the meat when the bell whistles, they're not going down that route again. And it's got to be quick. Do you agree with that?
Well, you've got a point, and I think that certainly illustrates some people's behavior. I'm not so sure about the long-term effects that you have to see that. I mean, some of these people who actually listen to me and start exercising will see the benefits much quicker. I remember I had a patient who I tried to talk him into walking every day, and he had an office job, a desk job. And he said, when I get home after I'm so tired at the end of the day, I don't feel like walking. And I told him, I said, well, just go out and do it. Just go out and walk for 30 minutes when you get home at 5 o'clock in the afternoon. And he came in the next time to see me and said, you know what, Doc? He said, I get home and I'm tired and I go out and walk for 30 minutes and I come back in. And I've got more energy then than when I started. Figure that out. How does exercise increase your energy? Well, part of the problem is the fatigue is mental fatigue. And after working all day at a desk job, it's not physical fatigue. And so
it's a lot, and walking
endorphins.
Is a lot better than a couple of martinis.
Yeah, you're right, Dan. It increases your endorphins, which has a natural antidepressant effect in the body, and in the brain, it's going to increase your.
I know.
Yeah, I'll tell you that's really true. I run up and down the basketball court like I'll do a small college game, and after the game, I mean it may be 9:30 or 10, and I should be tired from running the equivalent they say of 2.5, 3 miles, but I'm just like high on life. Unfortunately, then I want to eat what we talked about earlier, some ice cream, which I'm trying to eat something else, but yogurt or something, but.
Drink 2 glasses of water and go to bed.
Yeah, it's the endorphins that really you get high on that exercise.
Yeah,
it's
kind of an interesting conversation. Everybody is concerned, or should be concerned, about health, and particularly in America, where we talk about obesity as if it's just normal, and we don't think about hiking or walking. That's why I'll go back to Scandinavia or Norway or Denmark or Estonia, which those people have what I'll call more of an outdoor lifestyle than we do here. I mean, here working, as you go into an office, you become sedentary, right? But there are some countries that their work has merged with their environment. So they want to be outside walking and hiking, right?
Yeah.
And I don't know that we all credit that to their better lifestyle, but I think that's part of it. They're out doing stuff.
Even if they don't do that, if you go to Europe, you notice that those people are walking a lot more. They don't get in their car to drive 3 blocks. If they have to go to a store 3 blocks away from there, they either take a bicycle or they walk.
You didn't ask me, but that was the other thing when I was in Europe. When I lived in outside of Paris, and I took the metro in every day, and I had to walk about 2 miles every day. By the time I got to the metro, walked to my office, so every day I was doing that walking. And I know for a fact that's one of the reasons that my health was
cutting
there.
out.
And at least my weight was, right? I was fine. I could drink wine every night. I could go out and eat foods, but eat a lot of over there. You don't eat that much meat. And the portions, getting back to the restaurant, the portions are smaller. I go to restaurants here and they brag about how big their portions are. And I'm thinking, who can eat all this? And if
Well,
they just reduce their portions.
they do that in the media too. If you take a look at some of the advertising on TV, I mean, they stick these hamburgers up in front of the camera. I look at that, even if I wanted to eat that, I'm not sure I could get my mouth around that thing. And
they brag about it. It's so big you can't eat it. Now, one more thing about your advertising, which I agree with you, by the way, on the advertising. I don't know how you control that, but the latest ad I saw showed a device that you could put underneath your desk and you move it with your feet, but it's automatic. And it actually says you don't need to do anything. It exercises for you. I'm thinking, wait a minute. You put it underneath your desk, it moves your feet. Now, I agree that it moves your feet, but you're not doing anything, right? That was the
and
ad.
guess what? It won't help you get any healthier. It won't help you burn up any calories. But whoever sold you that device just made some money.
Yeah.
Like,
so they don't care about your health.
Here's the
they
AI
just care
analogy.
about selling their product.
The AI analogy is this. Here's the thing, folks. You don't have to walk anymore. Buy this robot. It'll walk 2 miles a day for you every day. That will be your exercise. Now I'm going to tell you, some people buy into that. That's another issue, because people don't think about potato chips. My God, go down a retail store, and how many different kinds of potato chips are there? A dozen, and potato chips, if you want to talk about something not only unhealthy, a pound of potato chips, which is a couple of sacks, can cost like $10 or $11. In other words, there's not many potato chips in a sack these days. They're reducing them. But yeah, you're right about this whole issue of I call them junk foods. Unfortunately, I like junk foods. I know they're unhealthy when I'm eating them, but I still like them.
That's what I think Kennedy.
So
I think Kennedy, that's going to be his legacy statement when he gets done, is Kennedy taking on the processed foods, and maybe more than the pharmaceuticals, but the processed foods. And that will be a lasting legacy. Like a John F. Kennedy, we're going to go to the moon by the end of the decade.
It will. He will
this
fail.
Kennedy could get us to change our food by the end of the decade. It would be powerful.
Yeah, it should happen, but I don't see it happening. I just don't see the lobbies are too powerful.
My view is that you can't take on a corporation which has as its mission in life to make money for its shareholders. It does not have a mission of morality. Yeah. And that's the way it's set up. That's the way capitalists have set up. My obligation as CEO is to make money for my shareholders. I'm not going to change. Now, you're going to have to pass some really strong law, but here, to me, the change has to go with the people. The people have to become so concerned about it. And I remember one of your items is taking aspirin, right? And my wife and I have talked about this many times, and her friends, and her, by the way, they all are aspirin a day. Now, I've never seen a report that an aspirin a day increases my life by 3 or 4 years. But because it becomes mainstream thought, we take an aspirin. So what I'm driving at is that Kennedy has to focus on changing people, not changing pharma. If people stop buying potato chips, guess what companies will do? They'll stop making them. But as long as people are buying potato chips, they're going to be sold.
Right. So my approach has been, I don't think that we can expect an administration to legislate changes in behavior of the entire society in America. I don't see that happening. And in the meantime, individuals have to protect their own personal health, because, even if you're 25 or 30 years old, there's not going to be enough dramatic changes in some of these bad practices that are put out by corporations that ruin our health and shorten our life. So everyone needs to take personal responsibility for their own health. And it's just like wearing seatbelts or following traffic laws. You can take your own personal responsibility and you'll live longer. I mean, I can get a convertible and go drive 120 miles an hour and without any seat belts. And yeah, I might have a lot of fun, but I'm probably not going to live as long just because increased risk of having an accident or something like that. But it's a personal choice of my behavior.
Yeah.
And so that's why I focus these talks to personal behavior that people can do at home on their own time, and they're doable. They're not extreme.
Here's where I disagree with you a bit. I looked at your list that you sent around. I guess, Dan, you sent them around.
Well, right? Bob, we're letting him go through that list, but when we've only got to number 9.
I want to hear Bob's comments.
Let me focus. The list is too long. That's the first thing. See, what I think, in my mind, it has to be really focused. And I'll give you an example. If I was going to start a cult movement, I would call it Walk America. And I would just focus on one thing: getting people to join this cult and walk every day. Because that's a simple, you said it, it's the simplest thing you can do. If you tell me not to eat potato chips, I might still eat them. But if I could join a group, Walk America, and every day I walk and I tap it and it says Sherwood walk, 4,000 steps. And now I'm getting Pavlovian, I'm getting some feedback. And I become proud now that I'm part of this Walk America cult. So what I'm really saying about your list, for me, it's too long. I can't follow all that stuff. But if you tell me, Sherwood, the number one thing you could do is walk every day, I think I could handle that.
Okay, anyway, Bob, I'm saying. Tell me what's on the list you can't follow.
Well, no, I never said I couldn't follow any of them. I can follow all of them. I'm just saying when I say the word can is different than may, right? And I'm saying the list, when I look at the aspirin, I guess I could get a bottle of aspirin and put it by my bed every day. But what's the easiest thing for me to do on that list? Getting up in the morning, putting on my shoes, and walking for 30 minutes. Doesn't cost me anything.
Exactly.
It's easy to do. I can remember to do it.
No cost, no side effects. You don't have to take any pills.
Exactly. So the whole list is obviously good.
So the other thing that I tell people is, people that they want to go to a health club or something like that, and I say, no. I say, it'll take you 2 hours to go to a health club, and people are busy. They don't have that much time in a day.
Yeah, I mean, you know what you're doing. You're a doctor, but from my standpoint, when I think about giving instructions to people, and I know from talking to other doctors that, people come back 6 months later, they haven't followed the instructions and want to know why they're not better, right? But you didn't do anything I told you to do, right? In my consulting business, when I work with lawyers, sometimes that'll happen. I'll say, look, I told you about this 4 months ago. Now you're asking me about it again. You didn't do what I said then. If I tell you now, how do I know you're going to do it now? So I have to be very simple in my instructions to people. And I've thought about this walking thing because my wife's a big walker, my son, my kids.
We lost you, Bob.
Bob, the ceiling looks great, man. I'm going to tell your brother-in-law, Helen's brother, that his ceiling is super clean and it's bright colors, and that's a great.
Yeah. My oldest boy does Ironman, and my 2 of my boys have done marathons, so they're all in pretty good shape, right? But yeah. So anyway, what happened?
So no, everything, but no, I just want to add, make sure people know, folks, you're listening to Banter, which you enjoy. Our guest is Dr. Keith Jantz. And just one note is one of the things Dr. Jantz does in retirement is he does consult with companies. So if you're out there thinking, some of the stuff he's saying is making sense, you could actually get a hold of him and he could come and create an on-site. He could consult with you to get your employees inspired, change their behavior, etc. Yeah. Now, this is my big opportunity because Bob, you're interrupting me. I'm not letting you.
I'm going to call my programmer today, and I'm telling my programmer to start up a website called Walk America.
Walk America. Well, okay. But Bob, let me ask you this question. Because in our banter, usually you're bantering me. Are you going to
ask it, or are you just going to tell me you're going to ask
I'm going to tell you, and then I'm going to tell you what I'm going to do, and then I'm going to do it.
All right.
So, okay. So you just said earlier that you acted like Make America Healthy couldn't happen. And yet a few days ago, twice you said you like the president, Donald Trump, because he said what he's going to do and then he's going to do it. Now, my challenge and my banter is why should we not expect him, Bob? Why are you not putting the same emphasis on health as you do on economics and money?
That's my
challenge to you. That's my banter.
I'm totally lost with the question.
You
All I know
are
is
you're not
what I'm taking away
foundationally
from
consistent.
this-
You said Trump, you love Trump because he does
Yeah.
everything he says he's going to do,
Yeah.
but yet you're ready to give up on Make America Healthy.
No, I don't think I've said that. But
No, you said that.
Not only that, but I'm
Replay.
saying this, that to me, we have to pick out one thing that we could become a cult. And I believe it's Walk America. Walk America, but not only just a website, but where you register your walking and you get, just like TikTok or all the other ones, you get like a gold star. You made your 5,000 steps, you made your 10,000 steps, you get gold stars. People actually TikTok and what's the other one that's big on that? You get stars and gold labels. All I'm saying is that the more complex the instruction is, the less it's ever going to be followed. And I
understand what you're saying, Bob, and that's why I tried to keep my talk extremely simple. And what you're telling me now is I need to make it simpler yet.
I think simpler.
And I see what you're saying, and I think the walking is a perfect choice because it's doable and the instructions are simple and anybody can do it. So
it fits everything. It fits everything about health. Walking, right?
Right.
Because in that, to me, it's like that's like a starting point. Now, once you're walking every day, you can then say, well, what else can I do? Now you've got other things on your list. You got a whole lot of things, but too many things. I don't know where to start.
From a behavior standpoint, they used to say for New Year's resolutions, don't make a whole long list of resolutions because you're not going to be able to keep them all.
Exactly.
And then when you don't keep them all, then you're going to consider yourself a failure. And so. Right. And so, let's make it. I understand that. So, that's a good point.
Now, I am going to start this website. You're going to see it.
There is.
I might ask you to help me design it.
You should do it. And Keith can be the official medical, the official medical spokesman. There is an AmericaWalks.org.
Walk America.
There is an AmericaWalks.org.
Bob, if you want a little carrot to hang out in front of people. There is some hard data that says that if you walk 30 minutes nonstop every day, 7 days a week, you will lower your risk for a heart attack in your lifetime by 20%. There isn't anything I can do as a doctor that will do that. There isn't any pill I can prescribe or anything I can tell you that will immediately lower your risk for a heart attack by 20%. And this is what I end my talk with. I tell people, if you don't do anything after I've gone through this whole list of 10 things that I think you ought to do, if you don't do anything different, just start walking.
Start walking, right.
Every day, nonstop. Right. And it's not 10,000 steps. It's got to be 30 minutes nonstop. But if you start doing that, you will see health benefits.
That's powerful right there. That's the clip. That's the clip of the day right there. It is simple. And it's enjoyable. And you know what it's like, Bob? It's like eating an Oreo cookie. It's very simple. What do? You unscrew it very fast. Not that it's healthy, Dan, but it's simple.
Have you read the ingredients on that Oreo package?
I'm going to. Didn't eat it. I'm just, there's a lot of big words here with my Nebraska 2.2 GPA. Fructose corn syrup. There it is.
There you go. On a hot dog ingredients, they can have 0.02% rat droppings and still make hot dog.
That's true of most food. That's true of peanut butter. It's been true in the food.
I didn't know that, but I remember something. Anyway, that's great, Keith. Listen, thanks a lot. It's really been inspirational to me because I realize that I know my own weaknesses with respect to behavior, but I know this. I can do the walking if I just do it. I just have to.
Well, I'm envious of you, Bob, because you get to go walk on a Hawaiian beach.
Yeah,
and we're
I will be
here with 10 foot of snow here. So
yeah. Well, we got to have you back, Keith, because I'm looking at this list and I'm thinking about not only a couple things we touched on, but how to shop, the power of sleep, the power of drinking water, a lot more to talk about. So, folks, stay tuned. If you enjoyed this, you can write us at webtalkwithbob@gmail, webtalkwithbob@gmail. If you want to get a hold of Dr. Keith Jantz, you can write webtalkwithbob, and we'll pass it on to Keith. Yep. And if you need some consulting.
Great talk, Keith. Great discussion.
So my pleasure. I enjoyed talking with you. It's something that we can talk about a lot, and I can talk about each one of these 10 things individually and go into detail on them if you want to. and try to keep it simple for people. Maybe after people have
No.
to do the walking and they got number one knocked out, we can go to work on number two or something else.
I'll bet Bob is texting his guy right now saying we need to get Walk America. Right now, I can tell that's why we can only see the ceiling. So, Bob, why don't you let us see your smiling face and wave goodbye? And,
hey, bye, Keith.
Okay. All right.
Take care,
Bye,
Bob.
Keith. Bye, America. Stay winsome out there. Don't be afraid to banter.
Bye, Keith.